Welcome to the second parallel session, KSPs for Infectious Disease Prevention and Control. Today, we will have presentations on KSPs conducted with 3 countries, Malaysia, Ecuador, and Ethiopia, regarding lessons learned in response to the COVID-19 pandemic, followed by a panel discussion. Now, please welcome moderator Dr. Seon-hee Lee, former Director General of the National Institute of Food and Drug Safety Evaluation. Now, I will give the floor to Dr. Lee. Dr. Lee, the floor is yours.
안녕하세요.
Good afternoon and good morning. I am Seon-hee Lee. Very nice to meet all of you. In this session, we're going to discuss the healthcare-related KSP programs, including KSP in Malaysia, Ecuador, and Ethiopia. And we're going to discuss the implications of KSP in the context of the COVID-19 pandemic. So this will be an opportunity to share the experiences in these 3 countries. We will analyze the circumstances and what policy recommendations were made. In this session, we are going to be able to learn all the lessons and challenges of the KSP projects in these 3 countries so that we can draw some insights on how to improve our programs and how to increase our sustainability. Let's move on to the first presentation, which will be on the 2020-2021 KSP with Malaysia, Strengthening Preparedness, Lessons Learned from COVID-19 Pandemic. The presenter is Professor Tae-jun Lee. He's currently Associate Professor at the Korea Development Institute School of Public Policy and Management. And he's also a researcher at the Global Information Institute. He's been working as an advisor to various ministries in Korea, including the Ministry of Culture and Ministry of Interior Safety. And he also served as an advisor to the Prime Minister's office. And he carried out more than 60 policy projects at the OECD and other institutions. So he has extensive knowledge in development, cooperation, and assistance. I would now like to invite Dr. Lee. Please go ahead.
Thank you, and I'm very honored to present Malaysia and South Korea, the government experiences and discussion on the COVID-19 and the pandemic, and the strategic responses to COVID-19. This project is composed of the 4 different chapters, and the sub dimensions of the study to help the 2 countries and the public managers, the competence building and the decision making, for effectively and coping with the COVID-19. The last year, the KDI and the government of Malaysia conducted this project to come up with an effective prevention and control system for infectious disease. The second chapter is making the very important lessons and implications for public governance and resilience in the face of COVID-19. The chapter 3, the attempt to deal with the measures, new measures, and the creative measures to enhance the effectiveness of the quarantine and the policies, using information communication technologies, especially from a public-private partnership perspective. The last part was to cover the financial strategies, the economic measures that could effectively responded to COVID-19 health crisis. First chapter, the magnitude and the dynamics of the virus and its effects on the vary, the prompting and the different responses and outcomes from the South Korea and the Malaysia. This study examined the epidemiological situations and responses to COVID-19 and from a global perspective, and aimed to establish effective infectious disease prevention and control systems in both South Korea and Malaysia by comparing preparedness and responsive system of both countries. This chapter, the analysis for effective prevention and control system for infectious disease, they conducted based on three aspects: global perspective, national experiences, and national competences regarding the COVID-19 pandemic. The result shows 5 recommendations, as you can see from this slide, to establish an effective prevention and control system for infectious disease in Malaysia and South Korea as follows. First, the surveillance systems and early detection systems against the large-scale transmissions should be strengthened. Second, systemic analysis on COVID-19 etiology and appropriate responses based on evidence are necessary. Third, the evaluation governmental responses, measures, and preemptive implementations are necessary. The fourth, health equity and protective measures designed for socially disadvantaged, they should be strengthened. Finally, healthcare infrastructure designed to counter emerging infectious disease, they should be prepared in advance, and the governmental responses, the capacity, they should be reinforced. Second chapter deals with the coronavirus and the disease in the 2019 and 2020, disrupting innovation at the national level. So because both countries, South Korea and Malaysia, have different political and economic environment, socio-cultural conditions, and policy process, and the cultures and the government operations, the national strategies and behavior changes in response to the emergency were different. In particular, both countries have created similar yet specialized governance cultures and innovation ecosystems. So this is study based on the analysis of two countries' capacity on the public communication and the citizen participation for trust building and inclusive society, digital transformation and data governance for crisis management to resilience, collaborative crisis management for agile, adaptive, and anticipatory governance, and strategic foresight and the futures thinking for new working method of government. The following for policy insight could be drawn upon from this study. First, active citizen participation and effective risk communication would enable a more inclusive society. The second, government and the society, they should become more human-centric with rapid digital transformation toward data-driven governance. Third, government should seek to become more innovative, agile, and adaptive along with a whole of a society approach and among solidarity-based communities, local governments, and civil networks. Last but not least, future policy implementation should foster strategic foresight and continuous learning that ensure optimized behaviors and the solution for future complications. Chapter 3 is very unique, the force of the project. ICT has been an immense support to the national infectious disease framework, test, trace, and treat for data collection and management, epidemiological tracing, as well as non-face-to-face treatment. One of the key implementations of the 3T approach conducted in South Korea in collaboration with private sector is done through the development of the global epidemic prevention platform in partnership with Korea Telecom using telecommunication data. Korea is also using various ICT-based measures to curb COVID-19, such as self-check mobile application and the self-quarantine safety protection application and global care code, the service. And the disclosure of a public mask sales data to use them in private sector to check the stock of the public masks and the QR code and call-based check-in services allowed for tracking the distribution of a mask as well as the visitors in the public domain. Lessons learned from the responses to COVID-19 tell us that in order to successfully implement ICT-based non-pharmaceutical intervention against the future epidemics, it is necessary to induce efficient rapid responses through establishment of active public-private partnership. Further, enhance investment in ICT infrastructure to better adopt mitigation measures and contain the epidemics in a balanced way by reforming the related ICT infrastructure and the legal system in advance to prevent the violation of the privacy and achieve a social consensus. Last two chapter. Korea's relatively successful response to COVID-19 pandemic is supported in significant part by strong and efficient public healthcare system that been placed to show that carefully sequenced and incremental approaches helped improve affordability and overcome political headwinds. And the efficient risk pooling via universal and compulsory membership and equal defined benefits, but differentiated insurance premium by income and wealth level have allowed the national health insurance to foster strong social inclusion and income redistribution during the difficult times. Based on the four chapters, recommendations and implications, we could develop the next step for the collaboration between South Korea and Malaysia. We propose the data-driven and ICT-based innovation in the public sector for infectious disease management and the crisis response as a future challenge for the government of Malaysia and South Korea. This will function as a catalyst for securing public safety, quality of life, and sustainable growth as these countries promote to enhance national responsiveness and predictability against the various infectious diseases that will persist along with other wicked social problems, such as climate change, aging population, inclusive growth, and political polarization. Government should develop the necessary ICT infrastructure and re-establish legal systems and the strategic public-private partnership in order to construct a national level data-driven administration system and predictive innovation governance for COVID-19 and other new infectious diseases. It is also paramount importance that a vision is established at the national level with a clear policy regulatory framework in order to increase the capacity to respond in crisis through utilization of data in ICT. These efforts should not be limited to national level, but expanded to entire the region of Asia Pacific and worldwide, where these two countries belong. Last but not least, it should be emphasized that in addition to responding to infectious disease, a data-driven and ICT-based transnational innovation network will foster the creation of an innovation ecosystem and joint responses structures, which will enable agile, accurate, and anticipatory decision-making in the government operation to promote sustainable development in a related economic, social, and environmental domain. It is expected that this study will provide a significant basis for future management of change and challenging in the intra-regional terrain. This year, 2021, South Korea and Malaysia, the government of Malaysia, it aims to conduct comprehensive research and a project and a consulting process on digital government and public governance and ICT and innovation ecosystem to provide directions and policy recommendations for Malaysian government and South Korea to provide the directions and policy recommendations for building a digital government and a data-driven public sector innovation in the post-COVID-19 era. Thank you very much.
네, 감사합니다.
Thank you very much for the presentation, Professor Lee.
말레이시아
So together with Malaysia, when you were analyzing the situations in both of the countries, he also talked extensively about Korea's response to COVID-19. We have a real-time chatting room open and available at this point of time. So if you could link that chatting room to the screen, we'll be able to go back and receive questions from online participants. So we look forward to your active participation in the chat. And after we hear from all of the three presenters on the KSP programs in these three different respective countries, we're going to have a panel discussion as well as a Q&A.
Now, we're going to learn about the KSP program in Ethiopia. So there was this KSP program to support establishment of outbreak and disaster medical control and prevention system of Ethiopia. Dr. Yoon from Yonsei University.
Dr. Yoon is a professor of humanities and social studies, and he's also a vice chair of the Research Institute. He's also an advisor, and he's also a visiting professor at Harvard University. He also worked as a cooperation-based doctor at one of the largest hospitals in Addis Ababa in Ethiopia. So we look forward to your presentation. Hello. My presentation is on supporting the establishment of the Outbreak Disaster Medical Control and Prevention System. I am Yoon Sang-chul. I'm responsible for the project implementation. I will begin my presentation. So the program went on for 8 months, starting from various COVID-19 related outbreaks as well as responses taken by Ethiopia from 2020. And with many of the collaborators, and also working with various partners with expertise, we wanted to explore a new direction for outbreak disaster medical control and prevention system of Ethiopia. And we also included in our project scope to provide directions for the next project ideas as well. So COVID-19 especially is one of the challenges that came on the foothills of the MERS and various other outbreaks. And we have done a lot of analysis in that regards. I don't think we should say that we're one of the successful countries in terms of responding to COVID-19, but from various angles, I believe that we were able to fare well in responding to COVID-19, although we were dealing with a completely new type of a disease, especially building upon our experience from the past, and also linked to the strong healthcare system that we have in the country. When we analyze the healthcare system of country, we usually refer to the 6 building block model that is presented by the WHO. It is very simple and accurate model that we can use. But if we're dealing with an infectious disease, especially in terms of its evolving nature, such analysis may not be so relevant because it is quite not really dynamic as a model, quite static. And it is maybe limited in ways that it's not able to really look at the interactions between different building blocks in the system. So in building the pandemic control and prevention governance, we were able to come up with the following elements. The pandemic is not just limited to one country. It has impact across borders and across regions. It is indeed global in nature. So this is a public health issue, but it's not only an issue related to public health because it is related to social issues. So it really requires a whole of government, whole of society approach, and also involves a lot of public as well as private sector participation as well. And medical, healthcare system, capacity building, infrastructure, all of these components are equally important. And at the same time, we need to have a public participation. And to encourage such private sector participation, we have to understand that there has to be a strong level of transparency, especially in terms of information sharing that is led by the government. So there are five important aspects to be considered. Of the three tools, the most appropriate model was identified for public governance. First, it is broken down into three different models: legal and bureaucratic model. It is good in many ways, but it's not really dynamic to understand the situation on the ground. And also in terms of performance-oriented and managerial model, it can be very effective in terms of providing an alternative for the future. And some of the model idea was adopted for a project, but especially when there's an ongoing pandemic, performance-oriented model was not suitable, especially in terms of performance of the healthcare system. And in terms of analyzing the interaction and interfaces with other components was not the most appropriate model. And however, it was very good in terms of capacity building. That is why we decided to use this as a methodology for a project, because it had a lot of merits to offer. And other models here, what are the responses that we have to put in place? And how can we actually ensure implementation, even if there's a broad framework for legal and regulatory implementation? And we wanted to first identify the bottlenecks. And going forward, it will be very important to de-bottleneck the process. And that will be a very important thing that will contribute to the infectious control and prevention system establishment in Ethiopia. So basically, in the case of Ethiopia, starting from 2020, the government has been very nimble and quick in responding to COVID-19. PHEOC, which is Public Health Emergency Operations Center, they put in place this interministerial response center promoting cooperation between the central government and local municipalities. An advisory committee was also put in place to provide expertise as needed. So Ethiopia has been very successful in responding to COVID-19. PHEOC especially served as a single window of communication and played a pivotal role in Ethiopia's response to COVID-19. However, there are still opportunities for improvement. Although there is this very strong framework put in place by the government, going back to our own experience with MERS, we didn't have a lot of experts in terms of epidemiological surveys. We didn't have a lot of laboratories and research centers. And there are a lot of lessons learned from the previous experience. So looking at Ethiopia, considering the fact that they don't have a lot of human resources for responding to the pandemic, and especially considering the fact that there are a lot of limitations in the healthcare service system and delivery, we need to understand that there is a transition underway in Ethiopia. Now they're dealing with a lot of chronic illnesses, which is putting a lot of pressure on the healthcare system. And the tertiary human resources as well as very ground level personnel were all under pressure and stress. But in terms of the primary healthcare, the field epidemiological capacity building would be needed, which would de-stress the overall healthcare system in the country. And also, there are minor symptom patients and severe patients there. Then once we have a lot of critically ill patients, then we need to have a strong expertise coming from medical professionals, because there are a lot of factors that are involved when we're dealing with critically ill patients. And in order to build such capacity, we need to have an inherent education and training system. And all of them have to be fully integrated. And there has to be a fair redistribution of resources backed up by informatics, which would improve performance in the process, even with limited resources. So we conducted this as-is analysis on the healthcare infrastructure, and we came up with the 2B scenario. There would have to be strengthened investment in the infrastructure and to improve efficiency by utilizing ICT in governance and management. Basically, performance-oriented analysis model follow this process. We have the overall governance structure, and we have execution mechanisms, which are based on 3 pillars of test, trace, and treat. Test, trace, and treat. You need to have a basic infrastructure to respond to infectious disease. You need more than just a commitment, because we're dealing with the new emerging infectious diseases. Has to be a lot of support for this. And linking that to ICT, we can enable leapfrogging for developing economies. They don't have to necessarily follow the economic model of developed countries, but by harnessing ICT, we can enable many developing countries to leapfrog the process. This will be relevant not only for the pandemic response, but also for new future crises and disasters, and also in dealing with critically ill patients. The KDI professor emphasized the importance of ICT system, especially in dealing with the infectious disease, because it really accelerates the dissemination of information. So information sharing is really critical in the early stage of responding to COVID-19. Especially, the case in point is EIS. Information sharing used to take about 3 days, but this was shortened to 6 hours in terms of sharing information on contact tracing. So this proved to be very instrumental in responding to COVID-19. So compiling disease-related information analysis utilizing ICT, it could really go a long way towards improving the efficiency of the current information system. In responding to infectious disease, it is very important to ensure public support. It's all about transparency, not really about system or having a regime. That is why ICT system would be critical in ensuring an effective response mechanism over the mid to long term. Ethiopia now has a single window system for responding to COVID-19, but there are some limitations because they're working under the federal framework. So in a situation where you're in a very critical situation, a level 4, the single window system would become strengthened to involve not only the federal government, but also the local governments, and also to strengthen the linkages between central government and municipalities. And that would really improve the effectiveness of the government's response to COVID-19. And again, capacity building is critical. Training and education is key because that would ensure increased resilience in the system. There are a lot of researches that I can note, but the one that is related to resilience of healthcare is that those countries that have quality care can become resilient the countries that have a lot of options for treatment, not only for major illnesses, but 44 essential healthcare services that can be provided by the country. Such country can really increase the resilience in the healthcare system. And that is something that Ethiopia should work on over the long term. And last but not least, based on this information that's been compiled, as well as the infrastructure, the government can utilize the system to facilitate their decision-making process. On an average, of course, we see medical emergencies that occur every 2 to 3 years, and I think it could really go a long way towards improving our response. In that regards, the critically ill patient treatment and care system proposals have been made, and building capacity would be important, especially through training and education programs. And we also proposed various ideas in that regards. In the COVID-19 situation, I was able to visit Ethiopia during the outbreak. It is because of the strong support and cooperation provided by KSP implementation and coordinating agencies. There was also active support by the Ethiopian government. So I had an honor to visit Ethiopia 2 times during the outbreak. And it enhanced the outputs of the KSP program, which was already limited by the COVID-19 outbreak. I also lived in Ethiopia for 3 years. But when I implemented this project by making these visits, it really improved my knowledge overall. Although, again, there were limitations, but the capacity building workshop that was conducted for the local residents, the experts, though they were conducted in the webinar format, were still useful. And I believe that it could really lead to other type of capacity building programs. To sum it all up, we learned a lot from Ethiopia, and our knowledge and experience were very much shared with Ethiopian partners. So I believe it was very useful and meaningful. This is what my mentor has been teaching me, has taught me. So we need to understand the contextual information about the country. We cannot just blindly impose a certain model on another country, regardless of their needs. I believe that we had a very good understanding about the context of the country, and we drew very meaningful results from the program. Thank you. Thank you very much. Strong voice coming from the ground. Thank you.
에콰도르 KSP에
Next, we're going to hear a presentation on KSP in Ecuador, which will be presented by Professor Byung-Wook Yu of Suncheongyang University. He is the center head of the International Cooperation Center in Suncheongyang University, and he is also working in Papua New Guinea, and he has a medical doctor license in Peru. So he's been involved in various ODA projects in many different parts of the world. And now we will hear from Professor Yu as to what KSP has been doing in strengthening preparedness in Ecuador. Hello, everyone. Can you hear me well? Yes, we can hear you clearly. I would first like to thank the organizers for giving me this opportunity.
Seoul, Korea, to our audience about this. 발표는 한국어로 진행하.
I will be presenting in Korean, and then later, if there are any questions from international audience, I will answer them in English. Let me now discuss the KPS program at Suncheon that we conducted in Ecuador, and this was related to COVID-19 responses, but also it included capacity building for responses to other types of epidemics. We worked with the Quito municipal government in Ecuador, which is the capital city of Ecuador. And we began this project in March this year, and it went on until September this year. We were not able to carry out the entire procedure because of the pandemic situation. Professor Yoon was able to visit Ethiopia. However, we were not able to visit Ecuador, but we did our best to carry out this project in this manner, given the current pandemic circumstances. Ecuador may be known to Korean people as the country that is located along the equator, but as I worked in Peru, I had many chances to visit Ecuador, and I also had chances to visit Quito municipal government, so I was aware of the situations there. But in 2020, which was last year, in Ecuador, after the winter season, well, Quito is located on the high lands, and it also had some coastal areas. So when you think about medical access and transportation access, there were many challenges. Therefore, when you look at the number of cases, there are more than 500,000 COVID cases. And in Ecuador, they have more than 30,000 deaths so far. And last year, there were many different crises. But thanks to the vaccine rollout and quarantine measures, now the COVID-19 situation in Ecuador has been stabilized. Now, when you take a look at the vaccination status, the completion rate is more than 50%. So you can see that the vaccine rollout has been quite successful. And this was not only supported by the government, but also awareness raising among the public. But what's unfortunate right now is that there are barriers to proper vaccination. There is distrust and mistrust among people in Ecuador about vaccination, but still they were able to raise the vaccination rate to more than 50%. When you look at the vaccination situation, you were able to see that Israel and other countries were quite successful. And for Ecuador, initially there was some short supply, but later Korea, Ecuador, and many countries were able to receive more supply of vaccines, and gradually the vaccination rate has increased. And the general public began to put more trust in the COVID-19 vaccine. This is well represented in this graph. So as of last month, the vaccination rate has increased quite significantly. Now, Ecuador has a very long history, more than 150 years of Western medicine practiced in Ecuador. And in the beginning of the 20th century, Ecuador healthcare system was actually better than that of Korea. So when you look at the situation there, they have the National Emergency Operations Committee, which is serving as the headquarters or the control tower, and they have the COVID-19 guidelines that were provided from the early stages of the pandemic. And similar to the social distancing scheme in Korea, they have the social distance measures, and they have created the traffic light system. And this was an interesting practice that we were able to learn from Ecuador, because this traffic light system was effective for those who are not literate. By using the colors, red light, yellow light, and green light, the government was able to communicate with the general public more effectively. Now let's take a look at the composition of the National Emergency Operations Committee. This is very similar to our Disaster Management Committee in Korea. They have the organization under the president, and then they have local branches, so that central government policies can be coordinated at the local level. And the composition of the committee or the structure has been effective in communicating and sharing national policies to the local communities. And also they provide policy advice, and they also provide guidelines on public health facilities, and they conduct they provide guidelines on conducting surveys on the medical and healthcare systems, and also they provide information on overseas cases. And this National Emergency Operations Committee also issues self-quarantine guidelines. And they also have the return to work guidelines. And regarding the traffic light system, I'd like to share with you more detail. So there are 3 different stages: red, yellow, and green. And the impressions of these colors are rather universal. They are understood globally. And here, when the light is green, this means that all kinds of activities can be carried out safely. But when the light is red, then there's curfew imposed. And then also for public administration offices and transportation services, the hours will be restricted. And the traffic light system was very effective in communicating the status of the pandemic to the people. But as you may know, the second largest city in Ecuador is a port city along the coastal area, which is similar to Busan. But also, there are many other cities that are rather isolated geographically, and Quito is also an isolated area surrounded by the mountains. So, in the rural countryside, such as Campo, this type of social distancing measures were not easily implemented. But depending on the situations of the local communities, these systems were implemented at discretion. And also, they have the temporary attention centers established. They call them CAT. And there are many mountainous communities where there's not enough transportation access. So Ecuador has focused on telemedicine to provide medical services to those who live in isolated communities. In addition, public communication was crucial. And so the Ecuador government utilized social media and public television and other broadcasting platforms. And in Ecuador, they may actually have better communication network for mental health care compared to Korea. In Ecuador, in all community health care centers and schools, there are facilities where you can check on with your mental health. There have been extensive lockdowns and social isolation in various countries. In Ecuador, these mental health care facilities were quite effective, and the Quito local government provided mental health care services to its citizens. And when it comes to data collection and analysis, there were a group of experts, and they have communicated with one another based on data. Of course, there were some restrictions and constraints, but as we were engaged in this project, we not only had KOTRA and other institutions in a webinar, but also we had chances to get together. We have infectious disease experts and healthcare professionals from our university medical center, as well as healthcare experts from Quito. So we were able to work together, and our recommendations were reflected. And the KSP program and its recommendations were well reflected in the policies of Quito, which would later be shared with other parts of the country. There were 4 different policy suggestions based on the Korean experiences, and these are the kinds of areas that can be implemented in a realistic sense. And even tonight, with Kotra, there will be a separate meeting once again, and we're going to have a Q&A session. So the local participants from Ecuador will be able to ask questions, and the Suncheonhyang University Medical Center is trying to use ICT technology and residential treatment centers and the control for outpatients so that we were able to share our experiences in response to COVID-19. The first area is communication. As I mentioned before, there are many aspects of communication. Of course, we need to communicate with the general public. If we are not able to share information efficiently, then any good policy won't be implemented successfully. When I lived in Latin America, I learned that there were many successful campaigns and there was high level of citizen participation, but depending on the level of education and depending on the level of or the content of communication, the effect may vary. So they focused on providing very key and very simple messages. And in Quito City, they provide fact-check services. People would say that if you hold salty water in your mouth and hold your breath, then this may help you avoid getting a COVID-19. And this may not be true. So for any such ideas, healthcare professionals will do fact check to disseminate accurate information and dispel any fake information. And at movie theaters and any public places, there will be communication. I visited El Salvador recently, and when I was taking an elevator, I saw that there were these footprints to regulate the number of people who would ride in the same elevator. So these visual aids were quite successful and effective in communicating key messages with the general public. And I believe that KSP suggestions will be helpful in this regard. And these web messaging is quite helpful. I'm sure Korean people are familiar with it. These mobile broadcasting service is what we recommended. And we also recommended the QR code check-in, while at the same time protecting privacy. And then there's self-quarantine application and other applications that people can use to monitor their health. If these types of services are provided, then the authorities can collect data. So we discussed this with the Quito municipal government, and we were able to share our experiences in response to COVID-19 at Suncheonhyang University Medical Center. And we also discussed the legal aspects and the feasibility of these policy recommendations in Ecuador. And of course, we need to consider the cost aspects, but in Ecuador and El Salvador and these countries, they may not be able to operate residential treatment centers fully funded by the government, but they may utilize some facilities where people with light symptoms would stay at home while people with severe symptoms will be treated immediately. But there was very unfortunate news in Latin America that many sick people with COVID-19 were waiting at home and they passed away. We need such supportive facilities so that we can prevent this pandemic from becoming an endemic. In order to help Ecuador with this aspect, we shared our experience in Korea with respect to residential treatment center operation. Suncheonhyang University Medical Center has been operating such centers, and we shared our experiences, and we shared with them what types of healthcare professionals are needed and what administrative staff are needed. and how we were able to operate such residential treatment centers. And by sharing our experience, the Quito municipality government was able to consider this option. And Quito is a major city in Ecuador. It is almost it, so there is this new airport that is right next to Quito, and this means that airport and border control is critical, just like what we are doing at Incheon International Airport. And as you can see here, these are open spaces, and there are walk-in through systems. And this system was introduced for the first time in Ecuador. For those who are coming into Ecuador through the airport, when there is no identification or documentation for COVID, then they would stay in temporary isolation rooms before their testing result comes out. And these spaces are quite useful because by having this, we can separate those who are waiting for the test result from those who are safe. Now, I like to ask for your understanding that I spoke slowly because I understand that there is interpretation. Thank you for your attention. Thank you very much, Professor Lee, for your presentation. So we have had 3 presentations, one on Malaysia, another on Ecuador, and another on Ethiopia. Now we're going to have a panel discussion.
So for the smooth moderation of the panel discussion, we are joined by 3 panelists. Professor Tae-hyun Kim from the Graduate School of Public Health at Yonsei University, and also from the University of Seoul, Professor Myung-won Kang is here, and from Ethiopia, Director General at the Federal Ministry of Health, Dr. Helena Tades is here. Could we hear from Dr. Tae-hyun Kim first? Please limit your comments to 5 minutes, your comments and any suggestions, and we will have a free-flowing Q&A afterwards. Dr. Kim is a professor at the Graduate School of Public Health at Yonsei University. He'll make comments about overall KSP programs, including the Malaysia program. Thank you.
예,
I enjoyed the 3 presentations. Thank you very much. Now we have the COVID-19 pandemic underway, and I can see that there have been many challenges in carrying out KSP projects amidst the COVID-19 pandemic. So I'm sure communication was quite challenging. If not for the pandemic, I'm sure many KSP project participants would visit the local sites and would engage in exchanges, but due to the pandemic, that has not been possible. So I'm sure there were many limitations and constraints, but nevertheless, all these 3 projects resulted in very good outcomes. So I'm quite impressed by that. As for the Malaysian case, there was a very detailed analysis on the situation in Malaysia, and also he offered many policy recommendations. And it really means that there are macro aspects of policies for public health care, and at the micro level, we need to expand the healthcare infrastructure and build capacity. And there's issue of governance and cooperation, and financing or funding related aspect was also included in his presentation. And finally, he talked about the data aspect. And among all these different aspects, I'd like to focus on the financing aspect, which I believe is very important. Korea has been quite successful in building its healthcare system, and we have been successful in responding to the COVID-19 pandemic. And I believe that we have this advanced healthcare system because we've been increasing funding and financing for public healthcare by utilizing the public health care and insurance system. And we have been making investments to build our capacity and develop human resources in the public health sector. Before the pandemic, there were some people who were saying that we had too many beds, but now some people are concerned about the potential shortage of beds available for patients. But once again, it really shows that we need to make investments in the healthcare system and to build capacity. Secondly, Professor Yoon Sang-chul visited Ethiopia several times, and I was able to see that this KSP project in Ethiopia was very practical and useful, and it emphasized the importance of building a unified governance structure, which means that the central government has to make decisions quickly and should be able to mobilize limited resources effectively to respond to the pandemic. And in this process, having good governance is a must, and I agree with what he said. And also, he emphasized the need to build the capacity and to develop human resources. And to do so, they need to secure financial resources. And there were other recommendations, including the creation of manuals for treating critically ill patients. And the final presentation was given by Professor Yu. And Professor Yu also is an expert in healthcare international cooperation, and he's well known in this area. The traffic light system in Ecuador was very interesting. And Ecuador is physically far away from Korea, but Professor Yu used to live in Latin America, and so he has a high level of understanding about the Latin American countries. And there were 4 specific areas where policy recommendations were made so that these recommendations could be applied right away. And one of them was communication, how we can improve communication during this pandemic, and how we can utilize ICT technology, and how we can use the residential treatment centers, and also how to enhance border control. I believe these 4 areas are all important, but the residential treatment center system that we have in Korea is going to be very useful. Currently, there are many accommodations and hotel and other residential facilities that are vacant because we don't have many tourists coming in. So we can use these facilities as residential treatment centers. And those who are housed in these facilities will be connected to healthcare professionals in a remote manner. So they will receive telemedicine, and they will receive appropriate medical support and attention. So once again, the KSP projects in these 3 countries offered both macro-level recommendations and deliver some specific policy suggestions. So I applaud their efforts. And investing in health is very, very important. You may not feel the need for such investment when you're healthy, but as with the pandemic, now governments understand the need to make investments in healthcare. These should not be understood as costs, but these should be understood as investments in national competitiveness and capacity enhancement. I hope that such lessons will be shared with many countries in the world. Thank you.
김태현 교수.
Thank you very much, Dr. Kim. He gave us a very effective summary of the 3 programs. Thank you for reminding us. So to Dr. Kang, you don't need to really provide us with a summary, but please focus on suggestions and recommendations for implementing KSP going forward. Hello? So I listened to all the three different case studies and the presentations, and especially I want to speak on the Ecuador program. And I would like to talk about some of the suggestions and recommendations for future implementation of the program.
The KSP project in Ecuador was centered on the Quito city, and it included recommendations that can be implemented right away, including residential treatment centers. So that was actually the demand from Quito city. And in response to these requests, the KSP advisors offered recommendations in 4 different areas, and there were excellent policy recommendations. And so in building this national healthcare system, communication is crucial. And the pause campaign and other successful campaigns in Korea were shared with those in Ecuador. And the QR check-in and self-quarantine guidelines were successful practices that were shared with Ecuador. And the residential treatment centers for patients with light symptoms can be applied in Ecuador as well. And as for border control, there will be temporary isolation spaces. These were quite effective in Korea, and they are shared with those in Ecuador. So these are very practical policy recommendations that can benefit Ecuador. And in promoting international cooperation, usually you would have to visit the local communities. You would have to meet with the counterparts. But due to the pandemic, physical visits were not possible. So they used virtual means and virtual platforms to carry out the project, which was quite impressive. And all these training sessions were done virtually, and still these were quite successful. So that was an impressive outcome. So these policy recommendations were made as part of the KSP project, and I think this really is suitable for the aim of the KSP. And some of these measures are actually implemented. And going forward, I believe that these suggestions and recommendations will contribute greatly to healthcare and COVID responses in Ecuador. And now we have some COVID-19 variants. So some say that the pandemic will not be over anytime soon. Now we have many successful COVID-19 response measures and good practices, and I'm sure many developing economies want to learn from Korea, and I hope that the KSP programs will be extended to other countries. And also, consultations have to change depending on the local circumstances. Ethiopia and other countries may be consulted on policies and fiscal and budget-related aspects. And I think we need to expand the scope of KSP consultations. And ultimately, they need to put in place an epidemic or infectious disease response framework and system. Currently, these KSP programs are short, 6 months or a year, and there are some longer-term projects. So I hope that the KSP projects will also be extended in terms of their timeline, so that it can be a multi-year program, which will lead to more contribution. And so the medium-term policy consultations can be done. And later, maybe some specific projects can be designed and implemented by dispatching some practical professionals and experts. So we will not just stay as policy, we will not just provide policy consultations, but these may lead to some actual implementation projects. Currently, due to the pandemic, Korea's ODA strategy has been changing to make it more inclusive ODA. And one of the strategic objectives is to share our experiences in COVID-19 responses. And also for ODA budgeting, the healthcare-related ODA will continue to increase. And so this year, there will be more than 300 billion won And next year, it's going to be more than 450 billion won of ODA for health-related consultations and projects. And recently, there were many international gatherings, such as COVIX AMC Summit and G7 meeting. And you were able to see that Korean government is very strong in providing development assistance. There was G20 health ministerial meeting, and the Korean health minister said that the Korean government will actively participate in international cooperation for healthcare because Korea can make contributions. As was mentioned by some other presenters, the public health insurance system in Korea is a very successful case, and this is something we can share with other countries. So this particular health insurance system is something we can share with developing economies. And regarding our approaches to wellness, the Korea's ICT programs can be implemented. So it's basically One Health approach, and this One Health approach is where One Health initiative is where Korea can take part in. And moving on to treatments and testing kits and vaccine developments, Korea can play a big part as a global vaccine manufacturing hub. There is some inequality and disparity in providing vaccines. So in this regard, Korea can provide support and Korea can play a big part. It really shows that Korea is very committed to providing assistance and support for other countries. Korea wishes to provide meaningful contribution, and I hope that this will continue. Thank you.
교수님.
Thank you very much, Dr. Kang. Next, we're going to hear from Dr. Helena Tades from Ethiopia.
Director General for Medical Services, General Directorates, Federal Ministry of Health in Ethiopia. As a medical doctor, she has served as many kinds of advisors and directors in the field of health system strengthening and quality improvement. Dr. Helena Tades, would you please make a comments or suggestion for KSP for this infectious disease or pandemic disease? Or if you have any question, please feel free to ask any questions.
Hello? Can you hear me? Okay, thank you. I hope you can hear me. Let me take my mask out. Is it audible? Can someone confirm me before proceeding?
Yes, I can hear you
I
very
can hear
well,
you.
Doctor.
Great. Okay, thank you. Thank you so much. First of all, I would like to take this opportunity to thank the Korean government, Korea Exim Bank, and the whole team of consultants who had supported us in the KSP project. And also thank you for providing me this opportunity to discuss with the team. The KSP project has offered a number of lessons on the need to continue investing in and improving the public health to build a resilient health system. So saying this, I would like to say a few things on our country experience regarding the COVID response. As we all know, the periodic occurrence of a regular outbreak poses a challenge to the health system, and the COVID-19 pandemic has tested our health system resilience. To date, our total case for COVID is around 340,000, and the current active cases around 28,000. And from this, almost 90% of the cases are located in Addis Ababa, which is the capital city of Ethiopia. And currently, we have around 800 critical cases, and the disease has surpassed the number of 5,000. It has now become around 5,400, and we have also started a vaccine program. And to date, we have given around 2.8 million. We have vaccinated around 2.78 million people. And as you may know, we are now in the third wave, with the positivity being around 14 to 15%. So ever since the first COVID-19 cases was detected in the country, several measures have been taken to prevent and reduce both the mortality and morbidity. So overall, we can say COVID is both an opportunity as well as a challenge for our health system. Just to mention the major actions which we take during the COVID response, the first one is establishing the incident management system and also establishing the emergency operating center. And then we have created a very good coordination platform. As a country, there has been a ministerial task force which was being led by our deputy prime minister, and there were regular updates among multiple ministerial wings. And in the Ministry of Health, we had a weekly strategic leadership and COVID task force meetings. We had a coordination platform between the Ministry of Health and the Emergency Operating Center. With the regional health bureaus, we had been running a regular joint steering committee to update ourselves on the progress of COVID, and also to take major actions to put a clear way forward between the Ministry of Health and the regional health bureaus. We had been preparing the emergency response, preparedness and response plan in different times. And there were also an interaction review conducted in between. We are now more than 1 year and 6 months since the start of COVID in our country. We also had a surveillance and testing as well, testing mechanism. So for the surveillance, we use active surveillance as well as passive testing was also being done at our health facilities. And we had an active surveillance at our point of entry. And regarding the facility preparedness and case management, most of, especially in the first period of COVID, almost all patients who tested positive, as well as who were suspected to be COVID, were being isolated in a standalone COVID centers. But now we have started home-based isolation, home-based isolation and treatment. So those patients who doesn't necessarily demand an inpatient service are being followed at their home with using our health extension workers, as well as the Warada health team is following those patients. We have been able to establish around 333 treatment facilities, among which 136 was an isolation center, and the total bed capacity was around 16,016, and currently we have a capacity of 653 ICU beds. So there was a lot of trainings being given, especially focused on the surveillance testing as well as the case management. And the other major critical area which needs our attention was the oxygen availability. Initially it was a challenge for our country because before the COVID era, our oxygen capacity for the essential health service was only covering our 35% of the supply was covering 35% of our demand, this is before the COVID. So you can imagine how COVID might strain our health system in regard to oxygen availability. So we have been pushing and working a lot to increase our availability as well as the distribution and the rational use. Accordingly, currently we are able to increase the oxygen availability by threefold from the pre-COVID era, and also for some areas where the distribution in the transportation was an issue, or the timing to get an oxygen was an issue, we are able to prepare a safety stock whereby our health facilities get filled cylinders free of charge, and the filling was totally being managed by the Ministry of Health. And other aspects like the infection prevention and control, as well as the non-pharmaceutical interventions were in place. And as I said earlier, we have started a vaccination program. And there was also a routine and frequent risk communication platforms to the community and to our healthcare providers. And the other thing was data. The data system was also established. Initially, it was a bit challenging. There is a gap, but I can say a data capturing mechanism or a data tool was prepared, and we were able to integrate it into our routine health information management system, which is the DHIS. And in regard to the resource mobilization, the ministry was actively engaged in resource mobilization of medical devices and supplies from different sources. Commodities were being pulled from donor countries and both international and local private companies. And in regard to the knowledge management and research, as a country, we were able to publish researches with around 150 abstracts, and 54 universities were involved in this. And the other major issue which we should have given a due emphasis, and in fact we have given it, is the essential service continuity. So for a country like us, the COVID pandemic will be a huge responsibility for the health system together with the essential health service. Since we have a lot of demand from the essential health service continuity, it was a bit challenging for us, but we were able to continuously provide both services. Initially, the COVID service was being provided in a standalone COVID centers, but later on, we were able to integrate it into the all health facilities, almost all health facilities. And so currently, both the essential service and the COVID are being given. And in the initial periods, we were also following the essential service continuity with all the important stakeholders. So through this journey of COVID and through the KSP project and through the knowledge sharing program we had with the Korean team, we have learned that there are some priority areas which still needs our focus and which still needs to be well addressed in the near future. These are strengthening the governance and improving the emergency health management system at all levels. In fact, we are now preparing to establish a comprehensive health emergency management system. I'm sure the KSP project has supported us in thinking this thoroughly, and we will soon realize this. And the next one is establishing emergency funding and supply chain management is also the second point, which we noticed that it still needs a priority. And also improving the critical care capacity in terms of infrastructure as well as the human resources, very important. And finally, establishing an emergency medical information system is something we learned from the KSP project and something we will be dealing in the near future. So all in all, I can say we have learned that protecting the public from both the public health and also the medical emergencies requires the capacity and resource. to ensure preparedness, prevention, early detection, and response. Thank you.
Thank you very much. 보건부에 계시다 보니까 그 열정이 너무너무
Thank you. I was able to see how passionate she is and how she was very dedicated. And unfortunately, we have time limits. I wish we had all the time to engage in in-depth discussions, but unfortunately, we are running short on time. And I can see that there are many messages in the chat box that they really express appreciation for all these discussions. And as Professor Yoon visited in Ethiopia, there are many issues that can be addressed further. Now, we understand that we're all part of this global village and we are working together. We are moving together in this direction. So I hope that we will continue to promote international cooperation so that we can help other countries. And finally, I would like to express my gratitude to Professor Lee, Professor Yu, and Professor Yoon. Let's give a big round of applause to the presenters. Thank you very much for their time. I'd like to also thank Professor Kang, Professor Kim, and Ms. Tades for their contributions as well. Thank you so much for their meaningful contribution. Thank you.
Distinguished guests, ladies and gentlemen, we extend our warmest appreciation for your time and participation today. This concludes day 1 of our event, but we will be back tomorrow with day 2, also packed with insightful presentations and discussions. Thank you again for your interest and support, and we hope that you join us again tomorrow.